Coronary heart disease. So, what is coronary heart disease? Coronary heart disease is a type of heart disease that is causing a huge amount of mortality rate around the world. It is the most common type of heart disease and is one of the major causes of death in America. Before we dig deeper into this topic, we need to first understand how does a normal heart function. So a heart consists of 4 chambers, 2 arteries, and 2 ventricles. The right atrium works as a receiver. It receives the deoxygenated blood from the superior and inferior vena cava after it has been circulated around the body. The blood then passes through the tricuspid valve and into the right ventricle, where it is then pumped into the lungs through the pulmonary artery for oxidation. In the lungs, the pulmonary artery branches out into numerous arterioles, forming into a network of capillaries that surround the alveoli. The walls of the capillaries and the alveoli are made out of only 1 layer of cells for a faster diffusion of gas. In the oxidation process, the oxygen will be coming from the alveoli and will be going into the blood and binding with the hemoglobin of the red blood cells. This phenomenon occurs because the alveoli has more oxygen and less carbon dioxide than the deoxygenated blood. Once the blood is oxygenated, it will then leave the lungs through the pulmonary vein and it will be received at the left atrium. It will be then transferred into the left ventricle through the mitral valve. The left ventricle is also the most muscular part of the heart because it is responsible for pumping oxygenated blood into the rest of the body through the aorta. In a healthy functioning heart, it would also demonstrate a specific waveform when using electrocardiogram, also known as ECG. The ECG consists of a P wave, a PR segment, a QRS complex, a T wave, and an isoelectric line. The P wave represents the atrial depolarization, the PR segment represents the delay at the AV, the QRS complex represents the ventricular depolarization, the T wave represents the ventricular repolarization, and the isoelectric line serves as a reference point for all waves to be measured. If the interval and the amplitude of the wave are in a normal range, then it is functioning normally. And if they're not in the normal range, then it will mean that they are not functioning normally. So, back to our topic of coronary heart disease. Coronary heart disease is significantly impacting people's heart and our health, and the cause of the disease is also very diverse. It is commonly caused by the fat, cholesterol, and other substances building up in the artery walls, forming plaque. Cholesterol is a lipid molecule that is present in the human bloodstream. And when access to low-density lipoprotein cholesterols, the immune system will automatically send out a white blood cells called macrophages to help manage this abnormal cholesterols. However, sometimes, instead of solving the problem and removing the overloaded cholesterols, the white blood cell may transfer it into a foam cell. And over time, the accumulation of these foam cells and other substances like calcium that appears in our blood may turn into something called a plaque, which may block and narrow the coronary artery, supplying the oxygen and nutrition to the heart and leading to the reduced blood flows to the heart and a condition called myocardial ischemia. So, what are the symptoms of this disease? The symptoms of the disease typically occurs when the heart demand for oxygen increases, like during physical activities and during stress. In this time, the patient may experience a shortness of breath and chest pain, and over time, this can result to heart disease and heart failure and eventually death. Even though mortality of the disease is relatively high, however, preventions can be done to prevent the occurrence of the disease. The first method is to have a healthy and balanced diet. A balanced diet can help control the level of cholesterol in the body. This prevents the buildup of cholesterol in the arteries and allows the metabolism to function properly. The second method is to maintain a healthy weight. When a person is overloaded, a large amount of blood is required for the fat tissues to be metabolized. The extra workloads may increase the risk of coronary heart disease because the elevation in the blood pressure can cause damage in the inner lining of the arteries and increase the probability of plaque building up. The third method is to exercise. Exercises can help reduce the chance of obesity and help manage a healthy weight. It helps exercise the blood circulatory system and the cholesterol levels to maintain a healthy blood pressure.